Let me paint you a picture. Two men stand side by side. One has a clear belly. The other looks lean and fit. And yet the lean one might carry the more dangerous kind of fat. Here is the part most people get wrong. The fat you can see is not the fat that worries doctors most. The hidden fat deep inside your abdomen behaves in a completely different way from the soft layer under your skin. That distinction matters far more than you might think, and today I want to walk you through it calmly, with no scare tactics. So let me back up and explain the basics in plain English. Your body stores fat in two main places. The first is subcutaneous fat. That is the soft layer sitting just under your skin. It is the fat you can pinch on your belly, your arms, or your thighs. The second kind is visceral fat. That sits much deeper, inside your abdominal cavity, wrapped around organs like your liver, your pancreas, and your intestines. You cannot pinch it. You cannot always see it from the outside. And that is exactly what makes it worth understanding properly. Here is something that surprises a lot of people. You can look slim and still carry a meaningful amount of visceral fat. The bathroom scale does not see it. Your BMI does not really see it either. A man can have a fairly flat stomach and still have fat packed deep around his organs. So body weight on its own is not the full story, and it never really was. This is what your body might be hiding in plain sight, and it is a big reason doctors care about more than just a single number on a scale. So why does the location matter so much? Imagine two storage rooms in a building. One is a quiet closet down the hall. The other sits right next to the main control room. Subcutaneous fat is more like that quiet closet. It mostly stores energy and stays fairly calm. Visceral fat is the room right next to the control center. It sits close to your liver and drains almost directly into it through the bloodstream. That position alone changes everything about how this fat talks to and affects the rest of your body. And here is the million-dollar question. Is fat just dead weight sitting there doing nothing? Not at all. Fat tissue is actually an active, living organ. It sends out chemical signals around the clock, day and night. Visceral fat is the more talkative of the two by a wide margin. Research shows it releases more inflammatory signaling molecules and more free fatty acids than the calmer fat sitting under your skin. So it is not just quiet storage. It is constantly chatting with the rest of your body, and not always in a helpful way. Let me explain what those signals actually do. One of the big ones is inflammation. Now, inflammation is not always a bad thing. It is your body's natural repair and defense system. But visceral fat is associated with a low-grade version that simmers quietly in the background for years on end. Studies associate higher visceral fat with this kind of chronic, body-wide, slow-burning inflammation. Think of it like a faint warning light on a car dashboard. It is not an emergency siren going off. It is a gentle signal that something quietly deserves a closer look. So where does all this lead? One key area is insulin. Insulin is the hormone that helps move sugar out of your blood and into your cells where it can be used for energy. The free fatty acids and inflammatory signals from visceral fat are associated in research with making your cells respond less well to insulin over time. Doctors call that insulin resistance. And studies associate visceral fat with this pattern more strongly than the fat under your skin. That distinction matters a great deal, because insulin resistance sits upstream of a lot of other problems. Now here is the catch, and I really want to be honest with you about it. Research associates higher visceral fat with a higher risk of type 2 diabetes. But association is not the same thing as proof. Many of these are observational studies. They follow large groups of people over time and spot patterns in the data. They do not prove that one thing directly causes the other. So I am not telling you this fat guarantees anything at all. I am telling you the pattern is consistent enough that serious researchers keep paying close attention to it. The heart is very much part of this story too. Research associates higher visceral fat with higher blood pressure, less favorable cholesterol patterns, and a higher risk of cardiovascular disease overall. It is also closely tied to fat quietly building up inside the liver. None of this means anyone is doomed or beyond help. Your personal risk depends on your genetics, your age, your activity level, and many other factors. But it does help explain why a good doctor cares about where your fat actually sits, and not only how much of it there is. So how do you get a sense of your own visceral fat without an expensive scan? This is where a simple tape measure quietly earns its place. Because this fat is hidden away, the scale can easily miss it. Your waist tells you a good deal more than your weight does. For many men, a waist circumference above about 40 inches is associated with higher health risk. For many women, the figure often cited is around 35 inches. These are general thresholds, and they vary by population, so please treat them as a rough guide rather than a verdict. There is another simple check that some researchers like even more than the waist alone. It is your waist-to-height ratio. The idea is easy to remember. Try to keep your waist measurement under half of your total height. So a man who is 70 inches tall would aim to keep his waist under 35 inches. It is a quick mental yardstick you can use anywhere. Measure around the belly button level, against bare skin, after a normal breath out. Remember, it is a rough proxy, not a diagnosis of anything. Now you might be asking, can I just target this fat directly? Sound familiar? We have all seen the burn belly fat headlines plastered everywhere. Here is the honest answer. You cannot spot reduce a single area of your body on demand. The idea that one special move or one product melts visceral fat away is simply not supported by the evidence. Your body draws on its fat stores more broadly than that. So instead of chasing one clever trick, it helps to look at the everyday habits that research keeps quietly linking to healthier fat patterns. So what does the research generally associate with lower visceral fat? Regular movement comes up again and again across the studies. That includes both brisk walking and some gentle resistance work. Better overall diet quality matters too, meaning more whole foods and fewer ultra-processed ones and sugary drinks. But I want to be really clear here. No single food and no product is a cure for anything. These are broad patterns seen across whole populations, and the effect varies quite a lot from one person to the next. Think direction of travel, not a strict prescription to follow. Two more pieces are very easy to overlook. The first is sleep. Short, broken sleep is associated in some studies with more abdominal fat, while steady, consistent sleep is associated with healthier fat distribution. The second is stress. Long-running stress and the hormone cortisol are linked in some research with more fat settling around the middle. Cutting back on heavy drinking quietly shows up in the research too. None of these on its own is a magic switch you can flip. But together they paint a fairly familiar and sensible picture. So let me try to pull all of this together for you. The fat you can see and the fat you cannot see are really not the same thing at all. One of them mostly sits there quietly. The other sits deep inside, stays metabolically active, and keeps showing up in research on inflammation, insulin, and heart risk. That is the simple reason the waist can sometimes matter more than the scale. I find that genuinely useful to understand, because it gently shifts the question from how do I look to what might be happening quietly inside me. All that being said, please do remember that this is general information, not personal medical advice. I am someone who spends a lot of time going through the research on these topics, but I cannot examine you myself. If your waist measurement, or your overall health has you wondering, the best next step is a real conversation with your own doctor. They can run proper tests, and read the results in the context of your life and history. So please do go ahead and book that checkup. And I would love to hear your thoughts in the comments below.